Medical Center is getting ready to offer free screenings on depression. It's free, also a confidential way that you can get some help. And joining us this morning is Dr. Sridhar Yaratha. Good morning, Doctor. Nice to have you with us. I guess depression is a subject that probably a lot of us don't like to talk about, but it really affects more people than we think, doesn't it?
It really does. It affects probably a fifth of the female population in America, and at least 10% overall. It's a very prevalent disease process, and sometimes we don't really recognize it in time.
How can a screening, such as the ones you're going to be having, how can that help to detect depression?
Sometimes it can give you forewarning signs of depression, feeling blue, having no energy, not sleeping very well, and kind of identifying a few of these symptoms can perhaps lead you to seeing a doctor or professional to get help for it.
For somebody who's thinking about maybe going through the screening, what are some of the things they can expect when they come to a screening?
Basically, they're going to have a videotape to talk about depression, and we're having 3 different locations that show this.
Sure.
And also, you might be able to fill out a little questionnaire that gives us a good idea. These questionnaires are fairly valid, and they work very well in identifying and screening for depression.
And it really is the first step toward getting some help, and there's a lot of help out there these days.
Oh, sure is, sure is. Now, we've noticed there's a lot of people with heart disease and diabetes have high incidence of depression, and with the new cancer, the cardiac center opening over at Genesis, we need to identify it better that way. And as soon as we do, the quicker we identify, the better we can treat them.
And treatment, I suppose, varies depending on the patient, doesn't it?
It really does. It doesn't always have to be medicines. A lot of times we have really good counselors that can help guide a person through the depressive phases of life. And usually what happens is a combination between medicine and counseling that works very well to help.
Some folks may be afraid to take that first step. What advice would you give them if they're thinking they have some of these symptoms, but they're a little afraid to come out to a screening?
Well, talk to your family doctor. That's usually the best thing to do. When you talk to a family doctor, he has a good idea. He knows you pretty well. And if he thinks there's depression going on, they can refer you to a mental health specialist or get you to see a counselor that can help out.
Good advice indeed. Now, these screenings are coming up in Bettendorf, Silvis, and DeWitt, sponsored by Genesis Medical Center. And for more information, give us a call here at the station, and we'll give you all the details. But important advice and good tips indeed. Thanks so much for joining us this morning, Doctor.
You.
Good advice indeed.